Good afternoon. This is Kim Clater, Compliance Director with NTA. We appreciate you guys joining us this afternoon for our webinar. We're going to examine this afternoon the different testing options of hair testing, oral fluid testing, and urine testing, and hoping that we can go over the different benefits, some of the pros and cons, and help the employer find the best fit. So we're going to go ahead and get started and take a look at each of these. And, of course, at the end of the presentation, if you have any questions, definitely would feel free to get in touch with us. So let's go ahead and we will get started. So what will be the best fit for your company? At NTA, when we're establishing a non-DOT testing program, clients many times ask us about urine testing, but normally they're not aware of their different testing options. We have hair testing, we have oral fluid testing, which would be, of course, saliva testing. During this presentation, we will examine the benefits of each type of workplace testing methodology. Now, I do want to take a moment to mention there are some different methodologies that I think people will see from time to time. We are asked about them. They are not common workplace testing methodologies. These would be sweat patches, fingernail testing, blood testing. Those tend to be the type of test that would be used more in law enforcement, that type of thing, particularly blood testing. That is usually not used in the workplace. It's considered too invasive. Fingernails, sweat patches, that kind of thing. It's just not very common. The technology, the collection procedures really are not in place yet for standardized workplace testing. So right now we are going to examine really the three standards that are out there, which would be urine testing, hair testing, and oral fluid testing. So the first one that we're going to take a look at this afternoon will be hair testing. And we're going to talk about first, how does hair testing work? What is hair testing? Since hair growth is fed by the bloodstream, the ingestion of drugs of abuse is revealed by analyzing a small sample of hair. Hair testing measures the drug molecules that are embedded inside the hair shaft, which eliminates external contamination as a source of a positive test result. Hair testing results cannot be altered with shampoos, bleaches, or other external chemicals, which that would also include hairsprays, anything that is applied outwardly. We get those questions a lot. Those things are not going to have any impact on the hair test. So if you look at the diagram to the right, it is going to show the hair shaft. It's going to give you the diagram of that. It goes down into the follicle. It goes through the cortex, the medulla, the hair shaft, and it shows the skin. Of course, it gets into that. And the actual shaft that is protected, that is what is tested. So there's nothing external that can really get into that can affect that. So those dyes, those chemicals, the bleaches, the hairsprays, that does not get inside the hair shaft. Those are that cannot get into those drug molecules that are embedded within there. So we definitely want to make sure that everyone does understand that. And as you look at this, you will also see, I want you to realize that there is a growth period, and we're going to talk about that momentarily, that does have to take place before drugs can be actually detected in hair testing. You're going to have roughly about a 5-day window before you can actually pick up drugs in hair testing. Now, sometimes it's a little shorter. It's just going to depend. So hair testing does have a little bit of a limitation, and we will examine that. Since the hair follicles underneath the scalp are surrounded by a dense network of capillary blood vessels, drugs in the bloodstream will bind to the hair follicles underneath the scalp. it takes approximately 5 to 10 days for drugs in the bloodstream to reach the outer environment on top of the scalp in the amount needed for the hair test. And this is what I was referencing. So when you're looking at these different types of tests and you're comparing, okay, or as a company, do we want to do a hair test? Do we want to do an oral fluid test? Do we want to do a urine test? You're going to need to make sure that you understand these time frames. So, for instance, with the urine test and the oral fluid test, they're picking up drugs that with very recent use, and we're going to examine those. How recent? With the hair test, it's picking up long-term use, but it will not pick up recent use. So that is an important factor that you're really going to want to keep in mind. The standard length of hair that is needed for a hair test is 1.5 inches from the roots. So you would want to think about the fact that you do have to have a donor that would have enough hair that the specimen collector could collect 1.5 inches from the roots. As hair grows 1.5 inch per month, this provides for a 90-day window of drug use. So every half inch of hair shows about roughly 30 days of drug use, approximately. So 1.5 inches from the roots. So obviously there will be some people that may not have enough hair for that. And you would want to look at an alternative method of testing for that. Hair testing for drugs of abuse is the only drug testing method that provides up to a 90-day history of repetitive drug use. When compared with urine testing, hair testing tends to provide the greater number of positives due to its longer detection window. So that is something that you would want to keep in mind as an employer. You are going to have a much higher rate of positives if you do elect to implement hair testing. So that is something that is definitely a key factor if you're looking at hair testing as an option for your program. You're going to have a higher rate of positives because you have a longer detection window. Hair testing, again, requires that 1.5 sample of hair. Head hair is the best conduit. Hair from other parts of the body cannot be conclusively utilized. Thus, if enough hair is not available, a urine or oral fluid test should be considered. So let me explain what they're saying here. Often I will have a question when I'm talking to a client about hair testing. They will have heard, well, if they can't get enough hair from the head, can they not get it from other parts of the body? From chest hair, underarm hair, leg hair, that type of thing. You could, and if you have ever been exposed to hair testing and you have looked at any type of collection procedures, they will mention that you can collect that. But the studies have shown that the internal hair shaft from other parts of the body, remember we went back, that shaft that it showed, it talked about the drug molecules and how they accumulate within that hair shaft. They do not accumulate the same within other parts of the body, the hair that grows from the other parts of the body. So while the collector may be able to gather enough hair, it is not as really a good of a conduit as the head hair, because again, you're not going to have as high of a concentration of drug molecules from other parts of the body. So if you can't get enough from the head hair, you would then want to probably have as a backup in your program, if you elect to do hair testing, you would want to definitely have as a backup urine or oral fluid testing for those donors and employees that would not be able to provide that 1.5 inch sample. So definitely a very important piece to keep in mind. Hair testing with some labs. Now, you have several different laboratories that offer hair testing, and you do want to keep in mind that some laboratories are not as extensive as this, but you do have some labs that will offer up to an 18-test panel. They will test for amphetamines, methamphetamines, cocaine, marijuana. The extended opiates gets into your synthetic opiates. That would be the hydrocodones, the hydromorphones. That would be the prescription drugs. The natural opiates, which again would be getting into the heroin, the Vicodins, that kind of thing. Then also you have your benzodiazepines. The benzodiazepines tend to be your anti-anxiety medications. That would be the Valiums, the Xanax, Clonopins, that kind of thing. Barbiturates, those tend to be the sleeping medications as a rule, also anti-seizure drugs. Methadone, those are usually the drugs that are used to treat substance abuse disorders, as is the buprenorphine, which you see down on the list. Then you have tramadol. That can actually be tested for on a hair test, and I'm not sure how many of the listeners would be, or the attendees would be familiar with tramadol. That came onto the scene several years back upon the advent of the opiate addiction explosion, and when the opiates, the prescription opiates were really, the pipeline was pulled back from the physicians where they were writing those prescriptions, tramadol was offered as an alternative painkiller. It is theoretically not a true opiate, but what they have found is that it does have opiate-like function once it actually binds to the opiate receptors in the brain, and it can actually create some real issues in terms of addiction. Does have some pretty adverse effects if it is abused. So you can test for that, whether it is a urine test or a hair test. Can't test for it in oral fluid, but it can be added to a hair test. Fentanyl, that is definitely a real problem. That is something that can be added. Ketamine, meperidine, propoxyphene, zolpidem, and then the last one is actually, that's where you're getting into your bath salt type thing. So hair testing can be quite extensive, or you can keep it very simple. It can be a standard 5-panel. It can look for just the standard drugs of abuse, marijuana, cocaine, opiates, PCP. So you can be as extensive as you would like. You can be just very simple, very standard. So again, hair testing is really quite sophisticated in terms of where they have gone with it. At this time, there are no known adulterants that can alter a hair test. Moreover, adulteration risks are minimized as every specimen collection is observed. So that is one of the really huge benefits of hair testing, is that you do not have any adulterants that we are aware of that can alter a hair test. You do have some, if you go on the internet, you're going to, of course, you'll see some literature out there that says that there are some things they can ingest, there are things that they can put on the hair, but there's really no proof of that. And when those things have been tested within the labs, they have been able to prove that, because, again, that hair shaft protects those molecules within the shaft, those things typically, it's just very, very difficult to adulterate a hair test. And again, we've already talked about this. While the dyes, hairsprays do not affect the hair test, one thing to keep in mind, however, if the donor specimen is contaminated with hair lice, the specimen will be rejected. That is something that can have an issue, because that can invade the hair shaft. The employer must ensure that the specimen collectors that are used, whether they're off-site or whether they're in-house, that they do have the correct hair specimen collection kits. They have a separate laboratory chain of custody form. There is a specific hair testing chain of custody form that has to be used. The specimen collectors have to be trained in the proper hair specimen collection procedures. So you can't just send a chain of custody form and a hair specimen collection kit to your local collection site without knowing that those specimen collectors know how to do this properly. And most of the laboratories do provide, they will have either a printable PDF instruction guide, or they'll have a little PowerPoint instruction guide, but you would want to make sure that those specimen collectors know how to do this. So a simple phone call would be probably a very good idea if you're wanting to do this. Or, as an employer, hair specimen collections are a good option if you decide to do in-house specimen collections. Because they are non-invasive, they require very little in terms of facility preparation. They're not difficult at all to collect. You can just pull the donor into a private area. You are provided with training, and then at that point, you just collect the specimen, protect the integrity of their privacy, their confidentiality, and then it is sent off to the laboratory in a prepaid FedEx lab pack with and prepaid air bill. So in-house hair specimen collections are a good option for in-house specimen collections if you choose to go that route. And just to make sure, USDOT hair testing, that is something that is currently in process. It is not available at this time. However, it is in process. What will happen and where they are right now, cutoff levels will be established. Guidelines and procedures for the laboratories will be established. As with the traditional DOT urine testing, hair specimen collection guidelines will be very specific, will be outlined in Part 40, and require specific collector training qualifications. Medical review officers will have specific guidelines for hair specimens, and employer processes and procedures will be established in relation to hair testing in Part 382 and Part 40. And that would apply to all of the different USDOT agencies. And this is also applicable to oral fluid. So USDOT is looking at hair testing and oral fluid testing at this point in time. So that is probably going to be an option for employers in the future. They will not be mandated to do hair testing or oral fluid testing. They will be able to choose. So if you have DOT employees, when this actually finalizes, when these rules are finalized, you can choose whether you want to do a urine test, a hair test, or a saliva test. And there are pros and cons to each one, as we are discussing today. So keep in mind that a hair test is the most effective way to evaluate long-term patterns of use. It makes it an excellent option for pre-employment and random testing because hair testing detects a pattern of repetitive drug use over a longer period, usually up to approximately 90 days. It is not an appropriate method for post-accident or reasonable suspicion testing. In both of these situations, the drug testing procedure should detect the drug as closely as possible to the time of the event. So you would want to keep in mind, if you decide that you want hair testing built into your drug-free workplace program or into your testing program, you would probably not want to use a hair test for a post-accident or a reasonable suspicion test because it's going to detect it for 90 days. And in those situations, you're looking for drug use that is recent, that is as close as possible to the time of the event. You would want to use a urine or an oral fluid test for those two situations because it's going to show that 12 to 72-hour window for those methods. So let's take a look at oral fluid testing, and then we'll take a look at urine testing. So oral fluid testing, how does it work? There is a device it obtains, and the most common one is called an Intercept 7. There are different things out there, but the most common one, it is a specimen tube, and it has a toothbrush-like device, and you see the tube at the bottom. The toothbrush-like device goes typically under the tongue, and it is left in the donor's mouth for a short period of time. Then the specimen collector will insert that within the specimen tube, and it goes within the tube within what is called a buffer fluid in the specimen container that protects it during transit. It stabilizes it, and then it's sealed and it's forwarded to the laboratory for processing. It has, again, its own chain of custody form. You get the kits, and again, you have your specimen collection training with that. So with the oral fluid testing, it is, again, it's quite easy. We'll go through some more benefits of that, but you do have one big downside to saliva testing. It is considered, of all of the testing methods right now, to be the least stable conduit for testing. So it's important to remember that this testing methodology is best used for those situations where the employer is looking to have very recent drug usage. Okay? That's what you want to keep in mind. So why would you want to consider oral fluid testing? Well, you have a few things. Number one, it is very easy to use. In-house collections are very quick. Again, they just put the toothbrush device, it's a toothbrush-like device under the tongue for a few minutes. They saturate it. You insert it within the vial into the buffer fluid. You seal it, fill out the chain of custody form, and you're ready to go. They're not as expensive as hair testing either. Adulteration is virtually non-existent with oral fluid testing. Again, there's nothing they can really do. It's not as invasive as urine or hair testing to employees. So hair testing can be an issue, particularly with females often. Females do not like to have 1.5 inches of their hair cut. That can be an issue, and that can be considered invasive to a degree. Urine testing, obviously, because of the nature of it, the whole nature of urine testing can be considered invasive. So oral fluid testing is really, of all three, the least invasive. So it's a good testing option for those companies that are interested in detecting very recent drug usage only. And then again, it's not as expensive as hair testing, and it has the benefits of the difficulty. You cannot adulterate it, and it's easy to collect in-house. Oral fluid tests are available in 6 to 10 test panels. So again, depending on what your objectives are, do you want to have this kept very simple at just the standard drugs of abuse, or do you want an expanded test panel? And again, this just goes through the basic drugs that are available for the oral fluid testing. And if you'll note, it does actually have there nicotine. So you can add that if that is if you have some sort of wellness program and you wanted to do that, you can add that to an oral fluid test panel as well. So not as expansive as it is limited. That is one thing about the oral fluid test. It is limited. You cannot get as many test panels as you can with hair testing, and certainly not as many as with urine testing. So, but you can get a fairly expansive test panel. And a few things to keep in mind about the oral fluid test kits. The test kits must be stored at room temperature to protect the reactive test pads and the buffer fluid. So whether you decide to do in-house collections or whether you are sending these out to a specimen collection site, you're going to have the chain of custody forms, you're going to have the test kits, and you need to keep in mind that you want to keep them at room temperature to protect that. So you are going to have some storage issues to keep in mind. You do have a shelf life. So as the employer, you would want to make sure that you look at the expiration dates. And if you are doing in-house collections, again, you want to be careful not to use an expired test kit. So the employer must ensure that specimen collectors have the correct chain of custody forms. As with hair testing, there is a specific chain of custody form that goes along with the oral fluid testing, specimen collection supplies, and that the collectors are trained in proper oral fluid specimen collection procedures. And one of those is, and it's very important that the collectors have to really understand, they have to ensure that the donor does not have anything in their mouth 15 minutes prior to the test. They cannot have any food. They should not have eaten. They should not have had anything to drink, any candy, gum. They should not have smoked. And they certainly should not have had any type of chewing tobacco, anything in their mouth at all within 15 minutes prior to the test. This can really severely interfere with the test. It is why it's very important that you use properly trained specimen collectors if you're going to do oral fluid drug tests. So again, that's whether you're using off-site or in-house specimen collectors. Make sure that they are properly trained. And again, with the USDOT oral fluid testing, again, it's in process. So let's take a look at the urine drug testing. How does it work? And this is the one that most everyone is pretty familiar with, but let's examine a few things about it. It is by far the most widely utilized form of testing by employers nationwide. It was the first testing methodology used by USDOT in 1988 and as prescribed in the original 1986 Drug-Free Workplace Act. Urine testing is very reliable, economical, and has withstood the test of time. And what we mean when we say that, it has already withstood a number of legal challenges in terms of the SAMHSA testing labs, the testing methodologies. The urine test goes through certain processes at the laboratory in terms of the emit screens, the GCMS process, all of those things, the collection process. Those things have been vetted and re-vetted throughout really the years since 1988 when they first started out with USDOT and again as prescribed in 1986 in the original Drug-Free Workplace Act. But urine drug testing does have limitations. So let's take a look at that. This is probably one of the biggest issues that we do run into. Urine specimens can be adulterated with relative ease. And this is really something that as an employer you need to be very familiar with. You have a whole host of items that are out there that the donors can obtain. They can buy commercial preparations that they can bring in small packets, in small vials. They can be hidden very easily because specimen collectors, whether they're doing DOT or non-DOT urine drug screens, the Part 40 guidelines are really the industry standard for specimen collections. And unless there are very specific things that take place, they are not going to do directly observed collections. So there are many places that these donors can conceal adulterants. They can put them in within their shoes, within their socks. They can conceal them in their internal clothing. There are devices, there are prosthetic type genital devices that have heat packs on them. They're called Wizinators. They're for males and females that they can actually keep the urines. They can buy someone else's urine. They can keep it warm. The specimen collector would not know because, again, they cannot go in the room with them unless it is a directly observed collection, which, again, within the workplace, you have to have very, very specific criteria for that. So they can be adulterated really with relative ease. It is not hard to get past a specimen collector and adulterate a specimen or bring in someone else's specimen. So that is something that can be done. Whereas with the hair testing and the oral fluid testing, that is something that is difficult I mean, it's very, very rare to be able to do that. Now, good specimen collectors, that being said, very good, very well-trained specimen collectors are very alert to that. They do watch them carefully. They have them wash their hands. They watch their behavior. They're checking the toilet. They're looking at the specimen. They're looking for temperature. So they're doing everything they possibly can. The labs do screen for some very common adulterants, so there are some checkpoints there. But of all of the testing methodologies, it is the easiest to adulterate. It is considered to be invasive by some donors, probably second to blood testing. It is certainly considered to be invasive, especially if it is a directly observed collection, a DOT directly observed collection. And you can have pH and specific gravity values. You can have certain things that can be affected by how much fluid a donor consumes. That at times can create dilute specimen issues, which, at times can get, concerning for the designated employer representatives at a company. So, you have to look at things like that and weigh those things. And if it's a company that you have a lot of employees that work outside and they consume a lot of fluid, you will see those. So they have to then look at their policies and think about, okay, how are we going to handle these negative dilute situations? Because if you do have employees working outside that do consume a lot of fluid in hot weather, you're going to want to do that because you probably will see negative dilutes. So you want to think about those. If you decide that you want to utilize in-house specimen collections simply because of convenience and cost savings, that becomes more complex due to facility preparation requirements, due to donor preparation requirements, due to direct observation requirements by USDOT in certain situations. So that can certainly become an issue for those employers that would want to utilize that. And I will say, for companies that have never considered in-house specimen collections, it is a very good, viable option, whether it is for hair testing, oral fluid testing, or urine testing. Particularly right now, a lot of the donors are uncomfortable. They worry about going into the medical clinics with the COVID-19 situation. It is something that is there, all of the different testing methodologies. Training is available. It is something that can be done. It can save specimen collection fees. It saves downtime. It's just really up to the client what their comfort level would be. And I will say with urine specimen collection, that is a downside. That is probably one that we do see clients have the least level of comfort with because, again, that's where you're actually collecting a urine specimen, and then you do have to seal it and deal with that. Whereas when you're dealing with the oral fluid and you're dealing with the hair, again, that's a lot less invasive, and the comfort level is a lot higher. However, we talked about some of the cons of urine testing. However, they are the least expensive by far of all testing methodologies. Very inexpensive. Oral fluid testing is a little more expensive than urine testing. Hair testing is very expensive. They have been around the longest. You have many more specimen collectors available nationwide. Much higher collector network nationwide for urine specimen collections than for hair collectors and oral fluid. Now, I will make a comment. At the LabCorp patient service centers and at probably any Quest patient service centers, the laboratory patient service centers, they are equipped. They are all equipped to do urine, hair, and oral fluid. Where you may have a problem finding hair collectors, oral fluid collectors, would be at the third-party clinics. That's going to be a problem sometimes. They're usually equipped to do urine specimen collections, but not hair or oral fluid. You have more test panels available with urine testing. urine drug testing. You can set it up for virtually one. You can customize it for really as many as you need. In terms of the drug, you can customize your cutoff levels. We have had clients ask for, I think the highest I've ever had, I had a request one time for 66 test panels. So they can be easily customized. You're not restricted in the test panels or the cutoff levels for urine specimen collections. So you do have some very clear advantages there. Comparison of drug testing methods at a glance. So let's look at this. We have urine, oral fluid, and hair. So the detection, the window of detection time. So in the urine, a drug user, if they have used drugs, you are going to detect it in the urine for up to 2 to 3 days. So you have that little bit, you have a 2 to 3 day window of detection of drugs in the urine. With the exception of marijuana, that can be up to 30 days, depending on how often they smoke marijuana. Then you come to oral fluid. The window of detection can be minutes, really up to 1 to 2 days tops. And with the marijuana, you would want to keep in mind with oral fluid, it typically is only for about 18 hours. So you're running into a much smaller window of detection with marijuana on oral fluid. The window of detection for hair is 1 week to 3 months. That's what you're looking at with hair testing. And typically the 3 months is by far the norm. Lab turnaround on test results. Urine, usually 1 to 2 days. If that's just a standard negative, if you have to do GCMS confirmation, it can go longer. And again, these are on negatives. With medical review, which you can get on all of them, it's going to take longer. Then you have lab turnaround on oral fluid, 1 to 2 days. Lab turnaround on hair, 1 to 3. So that's fairly pretty much all in the same range. Adulterants are common with urine. They are rare with oral fluid, and they are rare with hair. The collection, specimen collection with urine, can be considered invasive, facility prep required. Oral fluid and hair, it's considered non-invasive. Collection times with urine, it can run from 5 minutes on an uneventful collection if the donor is able to provide enough urine and there's not a problem. It can be as short as 5 minutes, 5 to 10 minutes, up to 3 hours in a shy bladder situation, because legally the collector has to give the donor up to 3 hours to come up with the specimen. Oral fluid, 5 minutes. Hair, typically 5 minutes. And then you would want to keep in mind that urine and oral fluid, again, they're the best options for post-accident, reasonable suspicion, random testing. Hair testing is the best option for pre-employment, and perhaps random, depending on your company objectives. That would just depend on your internal objectives. And this is just a really easy to read chart if you are more of a visual learner. So wrapping up, you would want to keep in mind, review your current company policy. You want to make sure that it does allow for your flexible testing options. I have seen policies at times that are only written to allow urine testing. So if you do want to change or add any testing options, you would want to make sure that your company policy does allow that. That is so important, because if you decide we want to add pre-employment hair testing, if that is not written in your policy and you have a signed and dated receipt by the employee of that, the problem that's going to arise if you add hair testing and you have a positive hair test, you terminate the employee. If that is not written in your policy as a test option, it is not going to hold up. So you would want to make sure you either have this in your current policy or you revise your company policy. Review your company objectives in terms of safety, risk management, and drug-free workplace goals. and see which one of these fits. Do you want to go with hair testing because it gives you that longer window? Or are you more inclined to just want to look at, we just want to know recent drug use? So that's going to steer you more towards oral fluid and urine testing. Decide if in-house specimen collections are a good fit for your company in terms of convenience and the cost savings. This will help determine which type of test may be the best for you. So again, oral fluid hair testing are much easier to consider and much easier to deal with in-house. However, all three of them can be a really good fit in terms of saving those specimen collection fees and the downtime, especially if you have a mobile workforce and you're having troubles finding collection sites, or you're paying exorbitant collection fees. In-house specimen collections, regardless of the type of test that you have, may be a good fit for you. And do please keep in mind that currently, as of April 2020, all DOT-regulated employees must still be tested via urine test using the Federal Drug Test Custody and Control Form, Part 40 Specimen Collection Procedures. The hair and oral fluid testing are future options at this time. So even though we did reference that, they're in the future. They cannot be used at this time using the federal drug testing option. If, as a company, you do decide that you would like to utilize the hair test for a DOT-regulated employee, for instance, we do get questions from DOT-regulated employees. They will ask us, they will say, well, we heard that J.B. Hunt or Werner Enterprises, they pre-employment hair test their drivers, and they do. That is correct. But that is done as a non-DOT company-required hair test prior to ever offering them a position as a commercial driver, which then they have to turn around and do a DOT pre-employment urine test. So they get two pre-employment tests. So that's how that has to be handled at the current time if you decide to do that. So finally, please feel free to contact us at NTA if you have any questions. I hope this has been helpful. We appreciate you attending our presentation. And again, please don't hesitate to contact us if you have further questions, if there's anything in the presentation that you felt you would want to add to your program, or any questions about any current piece of your program. So again, thank you and have a great day.